talk to me about what you found when you looked at the research on this mRNA vaccine.
I will never get over or understand why all of a sudden in pregnant women who can't even eat tuna fish, all of a sudden it was safe to inject an experimental based product that was known to have these effects.
People have emotional reactions to the mRNA platform. They immediately have an opinion just based on how they feel about it. But we're scientists. We're supposed to look at this. I'm generally the opinion that I'm not interested in withholding anything from physicians, sort of quiver. If they want this in their armamentarium, fine. But if they're going to apply it, they need to understand the risk reward of that application. And you're saying the study was poorly done.
People should know that it's not just this Mflusiva product that recently got FDA approved that's in the pipeline. There are a lot of mRNA gene-based therapies in the Moderna pipeline alone right now. I just want to throw that out there. This particular product did get recent FDA approval for our elders. They always seem to target the elders first. And it was not compared against a saline placebo. The study compared this new mRNA technology against a conventional, we'll just call it that, influenza vaccine. And even still, the mRNA product was associated with more deaths. And what I did, I wrote a Substack about this, was I introduced the idea of comparing both of these, the regular flu vaccine and the mRNA vaccine, against what might actually appear as results in terms of a placebo. You would never expect serious adverse events to arise from being injected with saline, and you would certainly not expect death. So if you assume, it's hypothetical, but if you assume that you compare both of these products against an actual saline placebo, from their own data, you see that there's 30 times, more likelihood that you're going to die. This is their data. And this is
how did that get missed by most people?
I don't know if it got missed. I mean, this book about how to lie with statistics. I mean, I don't know if they're borrowing from that, but one of the ways that you can hide the problems with vaccines in general is to compare it to a previously existing vaccine. But the thing about it is, that's not good enough, because those previously existing vaccines are also, associated with adverse events. They don't tell you that. If you compare something, a new product with something that exists that's already problematic in terms of adverse events, you see what I'm saying? It's like, can't. It's ridiculous. It's just one of the tactics that they seem to use. And what I don't get is why the FDA is in favor of approving this, not only the products, but the methodology. I mean, it's so flawed.
Well, they get, I bet you I know what's happening. I bet the conversation in the room was, it's so important that these people get the flu vaccine. We can't possibly ethically give them I'm sure it's what it was. We can't give them a saline vaccine because, oh my God, they're all going to die of the flu. And if you also saw, there was an interesting study came out about the use of Tamiflu in flu patients. It was in patients in the ICU dying of complications of flu, probably secondary pneumonias, and they give them it's insane. The flu, for you all, if you have access to a flu treatment, Tamiflu is a good one. There are like 2 or 3 others that are very similar, but you have to use them early or they have very little effect. You got to reduce the viremia. That's what they do. Once the inflammation's in, think about COVID. I think we learned that during COVID. Once it's down in the complications into the cytokine storm and the pulmonary emboli and all that. It's no longer about the virus. It's about what the virus had done.
The flu is, it's a fast mutating virus. There's antigenic drift every year. We all get the flu, it's not really dangerous for most demographics. The flu shot, in my opinion, is completely bogus. It's just another money-making scheme. So if you're considering, or if you have a loved one who's considering, injecting themselves with this, please apprise them, first of all, of the common sense. You can always enhance your immune system using zinc and vitamin C and zinc ionophores like quercetin. There are ways that you can optimize your immune system so that you have a better time, let's say, when you do get exposed to the flu, which you inevitably will. These products come with risk, severe risk. I mean, what we were just talking about is not chills or fatigue or malaise. This is death. And this is their own data.
So I want to get into this article you wrote about in response to the New York Times saying, we know that the COVID vaccine doesn't cause miscarriages. What did they get wrong?
Just about everything. So for context here, for the people who don't realize, thanks to Senator Johnson, we got a hold of not only Fauci's emails, thanks to Senator Rand Paul, but we got a hold of his phone. So it was too important for Senator Johnson not to disclose one of the messages that they found within the text messages. And it was written from the Surgeon General at the time, I believe, Dr. Murthy, to Dr. Fauci. And it's in reference to a concern about the mRNA shots, the COVID shots, causing mutations in the developing fetus. And this was due to cytokine storms post-second dose, as per their messages. So Dr. Fauci responds, I asked around a lot more, and another issue came up that you need to be aware of. Since many people have significant cytokine storm and fever after second dose, this theoretically could be associated with miscarriage in the first trimester. And this is a very prescient warning. Fauci was absolutely correct when he said this. And by the way, this was said on the 25th of January in 2021. This was very shortly after the initial rollout of the injectable products, the COVID shots. And the thing about this is that, I mean, you can read my Substack to see all of the points that I debunk, but what he said was absolutely correct. I couldn't even post the number of published articles, peer-reviewed published articles that confirm what he's saying. If you have a disruption in the inflammatory response, from the immune system due to something, i.e., due to the COVID shots, which was a thing, you could induce a miscarriage. They knew about all of this. And so, the article's title, the New York Times, article title is COVID vaccines are not linked to miscarriage. Here's how we know. And they first of all, they're using, the Republicans are saying this very strange language without ever actually addressing what was stated in this text message from a biological point of view. They don't even address it. They go back to this, these people are saying that the New England Journal of Medicine article was saying that there were 82%, miscarriages instead of the reported 12.6. And by the way, for all of you people who don't realize this, they had to change their claim. They were forced to publicly correct the mistake that they made in their calculation because they used an inappropriate denominator. So when you change the reporting frequency of miscarriages in the test subject in the first trimester, first and second, it goes from 12.6 that they reported percent miscarriage rate to 83. So That's what they focused on. They still didn't acknowledge that there was an admission of a public, correction of a mistake.
Yeah.
That's what they focused on.
And not only that, but while the miscarriage rate in the first trimester is like something like 10-12%, the miscarriage rate in the second trimester is like 5%. The miscarriage rate overall is 1.2%, and they used the overall 12% for the entirety of a pregnancy as somehow not an increase when it should be 1.2%. It's 10 times what the usual rates are, and no one just put it out there like, well, of course, this looks fine. It's really kind of extraordinary, and I completely agree with you. The cytokine issue, when I saw that, I thought at minimum, we should have been having a long discussion amongst physicians, amongst professionals about the fact that cytokine activation, that's a profound thing. Even outside of pregnancy, it's the second booster is creating the second shot is creating a cytokine activation. That is like, oh my God, you have to share that with your patients. You have to do that. And by the way, a lot of the really bad vaccine reactions I've seen is either after the second shot or the first booster. That's where the stuff really got bad. And I assume it has something to do with this activation, which is a profound thing. It's a profound immune reaction, and we don't know where it goes or what it's long to. We have no idea. So yes, I agree with you that the fact that was in a message, the fact that was there, and 9 days later, all we can say is safe and effective, and no conversation about it, and then pressuring Walensky not to talk about it. That to me is not just reprehensible; it's sick.